I'll start out with a quick self-intro, although thank you very much for that intro. Yeah, like you mentioned, I'm an assistant professor in UC Berkeley in computer science, and then I'm jointly appointed in UCSF, UC Berkeley's Computational Precision Health program. For those of you who haven't heard of this, it's this relatively new program. It's a few years old that's cross-campus, and it's about applying computational methods to health, including both healthcare and public health. My side is more on the public health side. I started in July 2025, so this is my second semester. My research is broadly at the intersection of AI and human behavior. And so this includes simulating and inferring behaviors with AI, as well as recently human AI interaction. I think a lot about generative AI and people interacting with models like ChatGPT. And then finally, societal decision-making over large-scale behaviors. For example, transportation planning or public health policies that interact with large-scale behaviors like mobility. Previously, I did my PhD at Stanford, and Yi mentioned that this is like a space for young researchers who might want to go in the job market. So I wanted to mention I was on the job market in 2024, so 2 years ago, somewhat recent. I'd be happy to talk about that experience as well if we have time for that. I also did a postdoc at Microsoft Research from 2024 to 2025 before joining Berkeley. All right, so my plan for today is to start with some stuff on mobility networks and pandemic response. This is largely work from my PhD. I've sort of separated it into work from my PhD versus ongoing work in my lab, closely related, as you'll see, but the mobility work is largely pandemic related, whereas the emerging directions are characterized by generative AI. And thinking about, in particular, can we generate mobility trajectories with diffusion models, as well as simulate human behaviors with LLMs? And depending on the interest of this group, I can end with a job market discussion if that is something that's on your minds. Otherwise, I can focus mostly on research. All right, and I planned for this presentation to be like 30 to 40 minutes with plenty of time for Q&A. And feel free to ask me questions throughout. All right, so let's get started with the first part, mobility networks for pandemic response. And so to set the stage for why we care about mobility in this context, we're going to be focused primarily on infectious diseases here, like COVID and the pandemic. And we care about contact because infectious diseases spread through contact between individuals. So for example, you have one person who is perhaps getting infected, and now she has some chance of infecting her contacts in the contact network. And then her contacts have some probability of infecting their contacts. And so you have this network between individuals where the individuals are nodes and the edges are relationships between nodes as people coming into contact with each other. And this contact network modulates the spread of disease. And so that's why we care a lot about this contact network and its structure. In particular, this network can help to guide questions like, how do we reopen safely? And so if you remember the pandemic and the reopening phase of it, trying to decide how do we reopen points of interest, how do we reopen outside spaces. And so understanding this contact network can guide, which sorts of places are safer to open sooner or later. It's also quite essential for combating health disparities. And so contact is not uniform across the population, but people have varying contact patterns that can then contribute to downstream disease disparities. The main challenge here, though, that we encountered during the pandemic is that we don't know the true contact network. And so we don't track in those places who is coming into contact with whom. But again, this contact network is extremely important. So if we don't know this true contact network, then what can we do? And so in prior work, and this was in 2021 through 2024, so really, peak pandemic. If you remember, the pandemic started in 2020, and so it really took over my PhD since it was the first year of my PhD, and we were already working with mobility data. And so we were thinking, what can we do that can actually help with this real world problem? What we decided to do was, can we actually use aggregated cell phone location data, for example, GPS signals, to try to infer much more fine-grained, realistic contact networks that capture people's real movements during the pandemic. And so that's really our goal in this work, to use aggregated cell phone location data to infer fine-grained contact networks. And if you want to learn more about this work, this includes both our Nature paper from 2021, as well as a paper that we published in the conference Machine Learning, ICML, in 2024. That's a more technical paper about how do you do the actual network inference. To get into more detail, The specific network that we inferred is this hourly network of visits from census block groups or CBGs. So these are neighborhoods of around 600 to 3,000 people in the US. To points of interest. So these are individual public locations, such as restaurants, cafes, grocery stores, so on. And we want to infer this bipartite network that says in every single hour, how many people from each census block group visited each point of interest. We want to set an hourly granularity so that we can then ask questions like who got infected where at what time because they were visiting the same place in the same hour. But to do this network inference, we don't actually have this network, we have to infer it from the data. And so this is what we have in the data. First of all, we have hourly visits. And so specifically the hourly total number of visits to each POI, and then also the total hourly number of visits from each CBG. Remember, those are the neighborhoods. So this essentially gives us information at the hourly granularity that we need, but it's not a network. And then on the other hand, we also have monthly estimates from our data provider of the home CBGs for the POI's visitors. And so that basically gives us a monthly network. So now it's a network, but it's not monthly. And so on one hand, we have the hourly information. On the other hand, we have the network information. The question is, how do we reconcile those two pieces of information so that we can infer an hourly network of visits from CBGs to POI?
So sorry, question. The second part implies that the data provider actually has the network you want to infer, but they didn't provide.
Very possible. Yeah, I think it's probably for privacy reasons that they don't provide it, and also maybe for noise reasons, because there's a lot of sparsity in the data.
Thank
Is this the SafeGraph data?
Yeah, this was a SafeGraph data. So maybe some of you worked with SafeGraph data during the pandemic. They were providing it for free to academics. Not anymore. But they do have, it's provided through like Advan / Veriset now, which maybe some of you are working with. Like at Berkeley, we have a university subscription to Dewey data, which gives us access to a lot of different data sets, including Advan and Veriset.
We have that as well.
Oh, nice, great. Yeah, we've been working with Veriset data lately. Veriset is interesting. They actually have individual device level information, and then Advan is more of the SafeGraph form, which is like aggregated over census block groups and over POIs. But what we do in our work is now we apply iterative proportional fitting. Maybe some of you guys know this method. It's like this sort of classic statistical method for matrix balancing. The idea is basically you have a matrix and you have your target marginals. So you know what you want the columns to sum up to, and you know what you want your rows to sum up to. And then you have some sort of initial estimate of the matrix. And so here we apply iterative proportional fitting, where the hourly totals essentially act as the column marginals and the row marginals, and then the monthly estimate acts as your initial matrix. And then by applying IPF, you can now learn a new fitted matrix that matches both the row and column marginals, but is otherwise as similar as possible to your initial matrix in terms of minimizing KL divergence. And so in our ICML paper, we dive into this a little bit more, which is basically saying, what is the interpretation of using IPF to estimate a dynamic network from its marginals? And we come up with a generative, we call this a biproportional Poisson model, under which IPF actually recovers the maximum likelihood estimates for that dynamic network. And so if you want a deeper statistical justification for why we do this, you can take a look at that paper. Okay, but for now, we're going to come back to the application of the pandemic. And so we now use this method, IPF, to infer hourly networks in 10 of the largest metropolitan areas in the US, resulting in 5.4 billion hourly edges. So one thing that's quite nice about IPF is that it's very lightweight. So it's essentially just computing scaling factors along the rows and scaling factors along the columns. And you can compute all of those in an iterative and parallel process. And so we're able to compute this large scale network. And then we integrate this network into an epidemiological model. And the idea here is that because the network already captures so much real world complexity, our epidemiological model can remain very simple. So the model only has 3 free parameters. They basically scale the transmission rates at POIs and CBGs, and they're fixed over time. So literally just 3 numbers. And we show that even with such a simple model, the networks enable our model to accurately fit daily COVID cases in these 10 largest cities in the US. And we also compare against ablations where we take the networks out and we show that the fit gets worse.
So in the SCIR model, like, do you
Yeah.
assume the parameters is already known, or you actually also calibrate the
Yeah.
SCIR?
So some of the model, yeah. So the SCIR, that's a good question. So we have this susceptible, exposed, infectious, removed model, which is basically an epidemiological compartmental model where you assume that people move through disease compartments. And so the main one that we're trying to estimate here is the transition from susceptible to exposed. So that's when you just got infected. And then the transition from exposed to infectious is basically the latent period. So for how long have you been infected, but you're not yet infectious to other people? We just use literature estimates for that because that's more scientific. Like you can just base it off of the biological process of COVID. And then similarly, we use literature to go from the infectious period to the removed period. So that's basically saying how long do you remain infectious. And so the main thing that we're using data and model fitting for is this first stage of going from susceptible to exposed, and that's where the mobility network comes in, which is basically you have a risk of moving from susceptible to exposed if you are at a POI where there are other infectious people while you are susceptible. And so that's where the model parameters and the mobility networks come in.
Do you also consider the infection within household?
It's good, yeah, so this is a limitation, I think, of the safe graph data, which is that we only observe visits to public places. I mean, again, it's a privacy question. And so we don't observe mixing within private locations. We do account for home infections, which is a very simple model where it's just like, I think, scaled based on the density of the CBG. And so we do capture that when we allow for home transmission, but we don't have such rich data there.
Thank you.
Yeah. Great, thanks for the question. And then we take these models and now we can use them to do sort of scenario modeling, to ask what are various use cases, can we model different policies? And so the first thing that we try modeling is analyzing reopening strategies, where we show that, of course, there is this trade-off between mobility and predicted infections, but are there more clever ways to get to balance that trade-off? And so, for example, what I'm showing you in this plot here is the x-axis is a proxy for the amount of mobility that you have. So that's the number of visits that you would have under reopening. And then the y-axis is how many predicted infections the model has after reopening. And so you can see as you have more visits, you have more infections, but there's a nice curve to this. And so what we find, for example, is that if you reopen, but you do a limited reopening where you cap the maximum occupancy, you're able to recover a lot of your visits without incurring too many new infections. So that's the kind of thing that you can do with our model, because now we can realistically simulate who got infected where and when, down to individual POIs with this mobility network that we can tweak. The second thing that we find is we can use our model to analyze disparities in infection rates. And so what we find is that the model only received the mobility networks. It didn't actually know which neighborhoods were lower income or more minority. But from these mobility networks alone, the model correctly predicts that lower income and more minority neighborhoods are getting infected at higher rates. And so then we wanted to ask, what is it about the mobility networks that encodes that sort of inequality? And we find that there are at least two mechanisms. The first one is that these marginalized communities weren't able to reduce their mobility as much early in the pandemic. And so if you just plot the number of visits per capita, there's a difference in the number of visits when you look at higher income versus lower income groups. The second thing is, it's not just about how often you go out, but where you go. And so we find that the kinds of points of interest that they're going to, even if you control for the type, so maybe it's all grocery stores, within grocery stores, the grocery stores that lower income people or minority communities are going to tend to be smaller and more crowded, and they have longer wait times. And so under the model, and I think realistically in the real world as well, but under the model, this results in higher infection rates for these communities. And so this sort of inequality is actually baked into the mobility networks themselves, and we don't actually require additional factors for that model to discover that inequality. Okay. When we released this paper, we were glad to see that it received attention and that people were paying attention to, this work from scientists. The results were cited by policymakers around the world and in a number of news outlets. What I'm proud of is we actually then deployed this model as a decision support tool for the Virginia Department of Health. And this is work that I led that was published in KDD, and that was the one that received the Best Paper Award. we basically turned our model into a front-end tool where these decision makers could use these sliders and essentially control for different amounts of mobility at different places and come up with a hypothetical mobility plan and run under our model how many predicted infections there would be. And then they could get granular information for different regions or different neighborhoods, how many predicted infections there were. And so it could help them guide more tailored plans instead of opening everything or closing everything, of basically exploiting heterogeneity and risk so that they could reopen partially and maximize visits while minimizing infections. And then one final word I'll mention is after we did all of this, at the beginning of the pandemic, one thing we couldn't really observe is how people actually respond to mobility restrictions. And so under our model, if we wanted to model something like reopening, we would just add visits back to gyms in our mobility network. But there's a good question of, in the real world, even if things are opened or even if things are closed, what does compliance look like and what does voluntary behavior look like? And so one more project I'll mention is 1.5 years later, we actually had the ability to evaluate what was the effect of various pandemic policies on mobility behaviors. And the specific effect that we wanted to study is, do we see spillover effects given the sort of patchwork of policies that we often have in the United States? So instead of having a federal response, we often have, counties doing different things or states doing different things from each other. And so if you're in the situation where you have, for example, a county that's closed, but then your neighbors are still open, do you see people geographically spilling over from the closed neighborhoods to the open neighborhoods so that they can still go out? And this is an important question because if they are doing this, then that's going to really undercut the intended effect of the policy, where, for example, COVID could still be spreading because people are bringing it back in from, when they visited the neighboring counties and then they come back home, or they could actually be bringing it to the open counties when they come from their closed county. And so basically what we did in this work is we developed a causal framework that allows us to estimate the spillover effects of policies. As I'm sure many of you know, observational causal inference is very hard. How do you do this without confounders? Here we found this really neat policy that allowed us to estimate unconfounded effects using a regression discontinuity design. And so specifically, California had this, what was called the blueprint for a safer economy. They had the counties being assigned to tiers at the cutoffs of COVID metrics. So something like if your test positivity goes above 10%, then you have to close your gyms, something like that. And it's these automatic changes in which tier you're in. And then we can basically estimate unconfounded spillover effects just at the margin of that threshold. And so for people just above the cutoff and people just below the cutoff, can we estimate spillover effects? And what we find is actually significant spillover movement from these more restricted to these less restricted counties. And it allows us to really quantify the cost of lack of coordination. And so we show that due to these differences between neighboring counties, county level restrictions are only 54% as effective as statewide restrictions. So statewide would be, imagine all of California had to be open or all of California had to be closed. If you compare that to just one county trying to open and close itself and seeing its effect on its population, we see that there's a very large difference in that effect due to these spillovers. So due to people still moving out and about.
When you say effective,
Yeah.
which matrix?
The metric here is the reduction in mobility. The reduction in mobility, but you could take this even further. We did it in this paper, but you could very naturally take this further by then combining this with our COVID model from the earlier paper, and then trying to model the spread of COVID as a result of these spillovers. And I assume you would see equally large, if not larger effects. Yeah.
Wait, county level restrictions result in
Small
only-
reductions in mobility.
smaller reductions in mobility
Yeah.
than if it were statewide.
Yes, yeah, because people
Yeah.
are still escaping to their neighboring counties. And so if the metric is basically how many visits are your residents still having, the number of visits that they have under a statewide policy, so everything is closed, is lower than the number of visits they would have if only your county is closed. Because if only your county was closed, then they can still go to the neighboring counties and have visits there.
I see.
Yeah. All right, so I went through this pretty quickly. I just wanted to give you an overview of this is the kind of work that I did in my PhD. You can also find my job talk online if you want to see a more detailed version of this. I'm also giving the ITS talk on March 6th. That is still happening. And so I didn't want to go through too many details because I might still cover some of this in my ITS talk. But yeah, that's a sort of overview of the mobility networks and how they can be helpful for pandemic response.
So in the
Yeah.
regression discontinuity analysis, like how do you handle this temporal aspect?
Mm,
So I'm asking this because like county can be in different phases of
Yeah.
this infection, but
Yeah.
they usually catch up with their neighbors pretty quickly.
because
So,
there's some sort of
yeah.
correlation
Yeah.
between them.
Yeah, so like, just like what you said, like the
Yeah.
mobility spills over and then
Yeah.
the neighboring county just quickly
Yeah.
catches up and then
Yeah.
they're closed as well.
Yeah.
So do you need to handle this aspect in the regression discontinuity analysis?
It's a good question. I think in this case, so in regression discontinuity design, the way that this, and maybe I'll just give a bit of a briefer for everyone, like it seems like you know RDD quite well. But RDD is quite nice because normally you can't just compare two populations, one that receives treatment and one that has control, because there are confounders that influence, like assignment is not random. And so a classic example of RDD is, and let's start with the simpler case, because I think our case is a lot more complicated. But the simpler case is, let's say there is just like a test, like the SAT, and you wanted to understand what the effect of some college prep program was on someone's college outcomes. So normally you can't just compare the people who did the college prep program versus the people who didn't, because they're different along a number of variables. In this case, let's say if you do, if you get at least like 2100 on your SAT, then you get to do the college prep program. But if you don't, then you don't get to do the college prep program. So now we compare people just at the margins of 2100, maybe 2105, and like 2095. And you look at people just at the margins to say, along close to the margin, people are very similar to each other. And so it's as good as random. Treatment becomes as good as random, depending on variance maybe and how they were feeling on the test day. Like maybe they were a little sleepy, or maybe their pencil broke in the middle of the test. And so you basically exchange the generalization of your effect. So you're only really estimating an effect for people at this margin. It does not generalize to people far away from the margin, but you're only estimating an effect for people near this margin, but now you don't have to worry about confounders. In our case, the threshold was something like the test positivity of COVID and I think like the case rate per population size. And so we would just focus on people who are at that margin. And I think it's as long as the outcome is conditionally independent of treatment, given the observables that you have, and in this case, the observables would completely determine treatment, then I think it's fine.
Sure.
But it's a good question about, the temporal part of it too. Like it is a much more complicated version of RDD than the traditional version. And there's also like possible, interference effects, because we're thinking about pairwise mobility from county A to B, but then like C might also be affecting that. So yeah, it is a complicated setting that I think could be thought about more. Thank you. Yeah.
Maybe we can pause for 2 minutes.
Yeah.
If there's any question
Yeah.
from the audience, yeah.
Yeah.
Oh, yeah.
Yeah, I had a couple questions. One is on the network inference
Yeah.
is non-uniqueness.
Yes.
How is non-uniqueness an issue? And the
Yeah.
second is in the compartmental model, is it fully deterministic?
Okay, yeah. So the network inference is non-unique. There are certainly multiple networks that would have the same marginals.
Yeah.
The nice thing about IPF is that you end up inferring the network that minimizes the KL divergence to the initial matrix. And so that's sort of like a principled way of choosing among all of the possible networks that have the same marginals.
Yeah, I guess an interesting question is like around that maximum value, how similar are the other networks?
Right,
And
like
it's
how
robust.
how quickly does it fall?
Right.
Like how you're saying KL, like.
Yes.
Yeah, it's a good question. I could check the plots from our appendix. But yeah, you're saying there could be like multiple networks around there that have similar KL and then you end up with the maximum one?
Right,
sorry, the minimum.
like the network with a minimal KL divergence. If you perturb some parameters
Yeah.
slightly,
Yeah,
then, then the network you would get
Yeah.
will be dramatically different. Is that the case? Like, is that something to worry about? Just
Yeah.
curious.
I don't think so. I think there are some nice like robustness properties here. We basically show that this is equivalent to a Poisson regression problem. That does have nice robustness properties, the perturbations in the observed data. And so you could essentially think of this as trying to fit a Poisson model, and there is some noise there as well, because you're drawing samples from a Poisson. And so I don't think small perturbations are gonna affect the final model, the network that you estimate too much, but it's a good question. Yeah, one thing that will affect it more is the appearance of zeros. So IPF is highly dependent on the initial zero pattern in your matrix, because all you're learning are scaling factors on the initial matrix. And so you can't turn a zero into a non-zero. And so if there's a zero in the initial matrix, then there has to be a zero in that position in the IPF inferred matrix.
I see.
We think that this is okay in the time aggregated version, because what's nice is like we're starting with the monthly network and we're trying to estimate the hourly. And so you would expect the hourly to have more zeros than the monthly.
Right.
And so does that make sense?
Got it.
And so if you had a zero in the monthly, it's like probably fine to assume you had a zero in the hourly as well. But if you want the other direction, that would be true. So the sort of pattern, the sparsity pattern of the initial matrix is quite important to the matrix that you end up inferring. And then your second question was, is SEIR deterministic? No, we are using a stochastic model there. And so it's basically like a draw each time of how many people get infected. And we ran the model 30 times for each parameter configuration to capture that sort of stochasticity.
Thanks.
All right, and here are the papers if you want to take a closer look. I'm now going to talk about some emerging directions that we have in my lab around generative AI. The first one, I think, is a very nice transition from the work that I was just presenting, because this is around mobility data still. And so here, previously, we were working on inferring these mobility networks that go from CBGs to POIs. And now we're asking, can we get much more granular than that? So can we actually try to estimate mobility trajectories? And maybe some of you have worked with this kind of data before. It's basically a sequence of places visited by the person. Maybe they start off at home, and then they go to a cafe, and then they go to a bank, and then they go to their office, and then they go back home. And so you have a sort of timestamp sequence of POIs visited by the person. And there's a lot of applications if you can start to infer these trajectories. For example, infectious disease modeling at the individual level, but also transportation planning or trying to measure social segregation. So who comes into contact with whom, or environmental risks in terms of which indoor places are they going to, estimating that at an individual level. And I wanted to mention this is work that's being led by my student Jessie, who's at Berkeley. So one of the challenges that appears in this trajectory generation literature is that there's a lot of demographic heterogeneity across people's trajectories. So of course, for example, young people are going to look different from older people. Like students will go to school on weekdays, and then people who are working, they might go to their office all days of the week or 3 days out of the week. And then maybe an older person who's in a senior home might spend a lot of time in the senior home or more in their residential area. And so demographic heterogeneity is very important to the sort of mobility patterns we have. And that heterogeneity then is important for downstream outcomes like COVID spread, as we were showing previously. The challenge here is that demographic heterogeneity, it's often really hard to get access to data that is both individual level trajectories and then also ground truth demographics. If you have access to such a data set, let me know. But it is quite hard to find that. Often for multiple reasons. I think one of them is for privacy reasons. I think another is that these trajectories tend to be gathered passively, and so it's cell phone data. And so how would you also get ground truth demographics from those people? You would have to actually reach out to them and collect them. But the data is already passive, and so you don't have the same active collection happening at the same time. And so what we develop in this work is a new method to learn demographic condition trajectories from available data instead. And so the available data we're using is one, we have trajectories that don't have demographic information. Two, we have region level mobility statistics. So think of, for example, for every CDG, we know the total number of visits to each POI. So these statistics would be POI visit counts, and we have them for every region. And then the third thing is we have region level demographic distributions. These are much easier to get. For example, trajectories without demographic information, that's Veriset. Mobility statistics, you could get that from Advan. Region level demographic distributions, you get that from the census. And so these are all much more readily available than the pair of trajectories plus demographics at the individual level. And essentially what we do in this work is we have a two-stage process. The first stage is training a generative AI model on the trajectories without demographic information. In this case, you're trying to learn P trajectory, the probability of a trajectory. The specific model that we use is a BART autoencoder followed by a diffusion model. The details don't super matter, but the autoencoder basically allows you to encode the trajectory into an embedding space. And once you're in the continuous embedding space, you can now use a diffusion model to add noise to the embedding, and then regressively, you can then denoise it recursively so that you get back to the initial. And so this is a pretty standard approach that people in trajectory generation have been using in the last few years. This is sort of the state of the art for trajectory generation. The thing that's new is now phase 2. And so now we fine tune our diffusion model on region level mobility statistics. And so this is where the model is learning not just P trajectory, but P trajectory given demographic. So the conditional trajectory distribution. The way we fit the model is quite straightforward. You sample from the model following the region's demographic distribution, which is available to you. And then you fit based on the aggregate loss between the model and the ground truth statistics. And so, for example, if you're using POI visit counts, then you compute POI visit counts for every region as implied by the model, and then you compare that to the ground truth POI visit counts that you have for each region, and the model learns the demographic part because you have the demographic distribution for each region. That's the basic idea. And in our work, we have both some theory that is analyzing under what conditions does this approach work better or worse. Like it's a little bit magical, and so it certainly doesn't work all the time. It could be arbitrarily bad, but under some assumptions about how are demographics distributed over the regions, and also how informative is your mobility statistic. Because you're going from a trajectory to a statistic. So you're not actually observing trajectories anymore, you observe POI counts. And so, for example, when you go from a trajectory to a POI count, you lose order information. And so you do lose information when you go from trajectory to statistic, and then you further lose information when you go from demographic level to region level. And so we basically have some theory analyzing the information that you lose along the way, as well as empirics that test how well this works. I was going to give a path talk on February 17th, but maybe I'll include this in the ITS talk then. And you can also come up to me with questions.
Sure.
We're going to have a draft in the next week. We're submitting this paper very soon. And so I can also share the draft with you if you're interested.
So, sorry, I think I missed the part about
Yeah.
the BART autoencoder.
Yeah.
So how is this being integrated with the diffusion model?
The BART autoencoder is meant to just take a sequence of POIs and then learn a continuous embedding of that sequence.
Okay.
And so it's actually trained on its own, and then sequentially used in the diffusion model, but it's not trained like jointly. And so the autoencoder's only loss is just a reconstruction loss. And so it's just saying, if I take the sequence and then encode it, now when I apply my decoder, can I get back the sequence? And so that's how it's trained.
So another question is,
Yeah.
so for example, let's say you have a neighborhood that
Yeah.
has half of the old people
Yeah.
and half of the retired people and half of the students,
Yeah.
right? So you may generate the trajectories correctly in terms of the population distribution, but it may not
Yeah.
be matched correctly with the
Mhm.
corresponding individual, right?
Mhm.
For example, you can generate the trajectory of mapping the old people, like retired
Yeah.
people go to school,
Yeah.
but the students go
Same
to
as
park.
that.
So
Uh-huh.
yeah, so how to avoid that?
Yeah. Yeah, so I think if you only had a single region, you would certainly have this
Okay.
problem. Think about, but then let's say that you had another region that
Okay.
was 0.7 old people
Okay.
and then 0.3
Right.
young people. That if you were doing your mapping in the opposite
Mhm.
order, then you would observe that for the
Okay.
0.7 and the 0.3.
Okay.
And so you're pointing to something important, which is basically one of the conditions that we show in our theory, which is quite intuitive, is that there has to be enough difference in the demographic mixtures within each region. If everybody has the exact same mixture, then you don't have identifiability. There's basically a full rank assumption that you have to make.
Sure.
That's like the ideal form of it, full rank, but basically as you lose demographic diversity across regions, the harder and harder this gets. Yeah.
So how does this compare to replica, for instance? Have you tried to compare this and the replica data set?
Replica. We haven't compared the replica. That's a good question, though. Yeah, we should. What we do compare against is we actually do have access in this work to individual trajectory and demographics. This is actually from a data set that Joan Walker put together, like the MD data set. I don't know if any of you guys know this one. But yeah, I was one of the students that I work with, Carlos, pointed us to this, which was extremely helpful because it is rare to have access to individual trajectories and ground truth demographics. And so we don't use that to train our model, but we use it to evaluate it. And so then we actually do have the ground truth to evaluate against. And we basically show that our model learns much more about demographics than the baseline model. It doesn't get any demographic information. And sometimes under some conditions, it can even get close to a strongly supervised model. So the strongly supervised model is the model that's actually directly trained on the pair of demographic and trajectory information. Yeah. Okay, so that's the current mobility work. I'll tell you briefly about some other simulation work that we're doing in my lab around simulating behaviors with LLMs. And so at a high level, like, why do we even want to simulate? I mean, I'm sure a lot of you deal with simulation as well, but simulating, often you want to do this because behaviors are difficult to observe. Maybe that's because of cost reasons, like surveys are very costly, asking people for their information can be costly. There's also privacy reasons. So maybe you did collect the data, but you don't want to release it. And then sometimes it's difficult to observe because the behavior actually has not happened. So that could be future behaviors, or that could be counterfactual behaviors, like what if scenarios, like what if we hadn't locked down, or what if we hadn't reopened during COVID? And so then why LLMs? There's a number of reasons. I think a couple of the compelling ones are, first of all, LLMs are very good at taking in natural language inputs and generating natural language outputs. And so that creates a really flexible space with which you can define a person. So if you want to, simulate a specific person, you can describe their characteristics and their past behaviors, any sort of thing that you can write in natural language. And then similarly for the outputs, you can now generate lots of different kinds of behaviors, all the way from open-ended text generation to networks, to sequences, to multiple choice selection, and so on. So that's the first reason. Another reason is social knowledge from pre-training. And so these LLMs have been trained on the entire internet, and people have shown that they have learned some interesting things along the way. They seem to be able to replicate or at least show directionality towards certain human behaviors without any additional training. And then finally, because of this pre-training and because of their natural language understanding, they're able to generalize to new scenarios. And so, for example, certain models, you can train them in a sort of supervised setting, and they're very good at the thing that they are supervised to do. But then as soon as you step outside of that, you have some sort of distribution shift or some sort of new task that you want to test them on, they are not robust in that sort of shift. But LLMs are much better at generalization than other kinds of models. So in our work, we've explored simulating a number of behaviors. I'm happy to go into depth in any of these that interest you, but we've explored generating social networks. So basically asking each LLM to act like a person, and then saying, who do you want to be friends with? And then we look at the social network that evolves and organically comes out of that prompting, and then we can evaluate the social network based on its properties, like its density or its clustering or its community structure, and see if it looks anything like a real social network. So that's one project that we've done. Another area of projects that we have several papers in is around predicting public opinion. And so here we're asking, can LLMs do a good job at predicting people's opinions about real world events or topics? And this can be quite useful for survey organizations who are trying to collect these public opinions. But again, these surveys are extremely costly. And so the LLM is not meant to replace the human participant, but to make these surveys more efficient and to get more bang out of your buck. So for example, being able to better target which population should I over or undersample using the LLM as initial predictor of what their opinions might be, where is there greater or less variance, which sort of question should I prioritize asking if there's greater uncertainty and the LLM has no idea of the answer, then maybe that's somewhere that you should prioritize in your survey. And then finally, one area I'm quite interested in lately is, can we use LLMs for evaluating AI models? And so a lot of AI model evaluation is quite static. And so we often throw some sort of benchmark at it, like MMLU, maybe some of you have heard of this. It's like a textbook kind of question. You ask it, homework problems, essentially, to see what sort of knowledge it has. But there's a very big gap between these multiple choice questions that LLMs are tested on versus how real humans interact with AI. And so, tons and tons of people are using AI like ChatGPT or Claude or Gemini these days. And so to understand how AI will look like in the real world requires understanding human AI interactions. And so we can do this through access to real human AI chats or through user studies, but you can't run user studies forever. And so at a certain point, you're going to run out of the data to understand the problem. And so if you want to be able to do scalable human AI evaluation, one thing you could do is try to simulate the human who is in interaction with the AI model. It gets a little meta. You want to make sure that you trust your simulator. But people have shown, and we've shown in our work too, that simulating the human can help you better approximate the true human AI outcomes compared to these sort of static benchmarks. So these are 3 directions of work that we're doing in my lab right now. We have this one paper on social networks that I could talk more about. We have this work on public opinions. And then we also have this work on human AI interaction. I don't know if you want me to, I can pause here to see if people do want to talk more about that, or I can move into the last part of the talk.
Yeah, I'm interested in number 2.
The public opinion.
To see how you can survey people.
Yeah.
But like, you don't survey directly people, you use the
Yes.
LLM to that.
Okay, great. So this is 2 works. The one that's under review actually just got into iClear yesterday. So that's ICLR, which is a conference on learning representations. And so the first work is led by my student Joseph, who's a PhD student here, also at Berkeley. And so in this work, we basically come up with this fine-tuning approach for fine-tuning large language models on survey data. Are you guys familiar with fine-tuning? Okay, great. Okay, so the way that we do fine-tuning here is we construct a large-scale data set of the format of, here is a demographic group, here's a question that they were asked, and then here is the answer distribution over the multiple choice options. And so then the fine-tuning approach is to say, I'm going to prompt the model with the group followed by the question. And then I want to look at the model's next token probabilities. And the next token probabilities are going to give you some probability distribution over the answer options, let's say like A, B, C, and D. And so now we fine tune the model to minimize its KL divergence between its next token probabilities over A, B, C, and D versus the ground truth distribution for that group and that question. And so that's the fine tuning approach. We construct a data set to train the model in this way. What's exciting is that we find, first of all, that fine-tuning outperforms prompting by a lot. So there had been some prior work in this area of like prompt engineering to try to use LLMs to predict public opinions. And we show that fine-tuning basically is much more effective. And so in this case, fine-tuning helps a lot. And then the second thing is that these improvements generalize to questions and groups that were not included in the fine-tuning data. So it's not surprising that you're going to do better on groups that were in the fine-tuning data, but what's cool is that the model is learning something generalizable here through the fine-tuning that then generalizes to questions and groups that were not included in the fine-tuning data set. And so this could be quite nice because like real world applications of these LLMs would probably be for questions that were not already seen by the model. Otherwise, why are you asking it to help you here? And so there's always something probably unseen in the settings where you do want to use this LLM. And so now we can show this generalization to unseen groups and questions.
I think I have a follow-up question on this. So I think there's a line. On the one side, you are fitting the real probability. But on the other side, you are kind of like enforce some stereotype based on demographics. You assume this kind of group, they are answering in this way. So I'm just curious, what's the current like some
Yeah.
concerns or best practice
Totally.
to like do not cross the line to enforce stereotypes?
Yeah, I think that's a good question, and that's actually a large motivation for our work. For example, these prompt engineering approaches where you weren't actually directly fitting on the ground truth distribution, but you just told it, for example, like you are a Democrat. How do you feel about abortion or something? The models would often underestimate variance within the groups. And so they would assume that all Democrats answer the same or all women answer the same. And then they would also sometimes like think that there are more extreme opinions. So for example, in the work that I didn't cover as much, we tried generating social networks with LLMs and we found that they never made Democrats and Republicans friends. There was an overestimation of political polarization, with implications for if you then wanted to use these synthetic networks to, for example, model the spread of COVID, there would be no way for the Republican cluster to then infect the Democrat cluster. And we know that there's a large amount of political homophily and polarization perhaps increasing in our society, but we also know from decades of social network literature that there is a giant connected component in these networks. And so retaining that giant connected component is quite important for how we analyze these networks. So to your question, yeah, I think these demographic biases are definitely there, and especially with prompting, then the model will just use whatever it thinks about that group, and often either underestimate variance or overdo its impression. And so we wanted to do fine tuning in part to directly teach it the real human distribution. By fine tuning it to minimize the KL divergence between the model predicted distribution and the ground truth distribution, it gets to see a distribution and not just one answer. And so now it's learning the variance within the group. And then also it can reduce its stereotyping. Like if it's overdoing the inference before it, now it can actually see the real human one.
Right.
Yeah.
So what's the fine tuning? So what kind of fine tuning have you do?
We're doing parameter efficient fine tuning here, so LoRa,
Okay.
low rate competition. Yeah, but we do compare to real, like full fine tuning, and there's not much of it.
Not much difference.
Yeah.
So how computationally expensive is this?
Yeah, it's a good question. I think it is still quite computationally expensive. And so in our follow-up work, we actually proposed two much simpler solutions to fine tuning. So I think the TLDR is like fine tuning works really well. If you have the computational resources, you should do that. But if you don't, there are two approaches. One of them is written here, which is probing, which can achieve like 70% of the improvements, with less generalization, but still pretty good. And then the other approach is to use a graph neural network. We have another paper that's under review right now.
That's probing.
Yes, let me tell you about probing. So probing is basically, instead of fine tuning the model, we can look inside the model. So the model has 32 layers, lots of attention heads in every layer. It's just like this really big beast.
Right.
And so currently, when we fine tune, we're only looking at the final layer and trying to tweak, those final tokens. Instead of fine tuning the model, could we actually see if there was more knowledge contained in the model that wasn't being properly surfaced at prompting time? And we basically find that this is true. And so we find that, there's an over 50% improvement in performance if you just better use the information that's already inside the model compared to just prompting the model. Specifically, the way that probing works is that you extract the model's activations. That's basically how are the neurons firing. You extract the model activations when you've given it a certain prompt. So for example, give it the prompt of like a specific group followed by a specific public opinion question, and you extract the model activations. And then you take that activation and now you train a really simple classifier, like a linear regression model. In our case, we use a multinomial logistic regression probe, but it's basically just like a single linear layer followed by this non-linearity. And so you just train a really simple probe to take activations and then predict your target. The target in this case is the human distribution. And so we basically show that the activations contain a lot more information than is actually getting surfaced by the prompt in the model outputs.
But this is a really smart way, because I often feel like the product, this LM product that is being offered, they kind of or have the ground truth being trained, but then when being provided as a product, they create some kind of personality on top of everything that they trained.
Right.
So then, in like for example, from previous like this kind of simulation related analysis, I often felt like the LLM represents a society where people are overly nice.
Yeah, totally.
So
Yeah,
maybe that's just something that is just part of the product that they.
I think that's right, especially these like chat models, the instruct models, like the ones that have been then fine-tuned on human feedback, tend to be very nice.
Yeah, yeah.
And so people have often found, especially for prompt engineering, if you're not gonna do further fine-tuning and you're just gonna use the model out of the box for simulation, the base models that haven't gone through all of the human feedback are often better for simulation.
Yeah.
Because they sound more like humans.
I think time use so far is perfect, so maybe jump to the last part.
Oh, actually, I saw that there's one more hand.
Great.
Okay. Yeah, and then I was just gonna talk briefly about the job market. I don't know if any of you are on the market this year, if this is helpful. But I went on the market 2023 to 2024. That was the final year of my PhD at Stanford. And I interviewed in a number of departments, although maybe not the kinds that you're looking at. I interviewed with computer science, information science, and business school. And so I have experience in those. If you have questions there, my job talk is online. I can also send it to you if you want to share it with people. But it's not that hard to find. Just look up, Serina Chang job talk. It might come up. And then my work was framed at the intersection of human networks and high stakes decision making. And so I basically framed it as, when we want to combine these two things, there are these core challenges that come up every time that you want to combine them. For example, how do you infer the missing networks? So that was like the network inference part that I mentioned to you guys. And then there's these modeling dynamic processes and decisions over these networks. And then finally, it's not just that the networks inform decision making, but then the decision making might actually shape the networks. And so that was the sort of spillovers part that I mentioned. And then I used what I mentioned to you guys today, the mobility networks plus pandemic response, as a running example of these concrete challenges.
So do you have one version for all the applications? Because I see you have multiple departments.
Yeah, I was lucky that I didn't have to. I think some candidates might need to. They are different in their norms. So like business schools are like one paper. So you have your job market paper. And then computer science, you often have maybe 2 or even 3 papers that you're covering. In my case, I focused a lot on the nature paper. And so I was able to basically use that as the backbone of my talk for both computer science and business school. And then for business school, it was like entirely that. And then for computer science, I mixed in the other stuff a little more, but it was still the backbone. So I didn't need to change things too much. I did apply to one political science department, and that one I had to change the most, but everything else was pretty much the same. Are any of you on the market this year? Nice. Good luck.
Thank you.
Quite a random question.
Mhm.
Do you still remember just one question on your when you interview on your job market you felt it was difficult to answer? Is that an example?
She's like, yes, I've been reliving it constantly.
I think they're a tough question. I think like the COVID work is tough because I think it was positively received in general, but I think it's just, we were doing like wartime science. Like it's hard to evaluate at a level that passes scientific confidence, even if decisions had to be made at the time. And so I think in terms of like, how do you know if those networks were correct or not? I think it's nice that we had the time to go back with the ICML paper to do a really careful pass of more like, establishing the methodological foundation. And there we actually could compare against ground truth networks where we had the hourly networks. We used like shared data for that. But I think, evaluation in public health is just hard because there's very little data for it. And so, it's a challenging thing. And I think I got questions about that.
Thank you.
Yeah.
Any question from the audience in this room or people on Zoom? Yeah, because I know Serena, you are.
Sorry, I have.
So, maybe we can also stop earlier so people can, have more in-person interaction.
Yeah.
And next speaker is mine. Why not tell us yourself, what are you going to talk about?
So I'm going to be talking primarily about how introduction charges in urban areas relate to EV adoption. Because what we're seeing in the economic all is a gap in public charger availability in urban areas where they have a different utility than you would find elsewhere. Because chargers in urban areas are often de facto at-home chargers because people don't have dedicated places to park at home. So I'm using basically every vehicle registration in New York City and comprehensive data on public charger locations in New York City over a 3-year time period to see if the introduction of chargers relates to higher EV adoption rate and what type of chargers will lead to the adoption rates.
Very cool.
Thank you. So, and here, and see you next week. Thank you.
Okay, thanks so much, Aiden. Wonderful. Thanks for the questions. Maybe wrap it up. I love to. Yeah, thanks. Yeah, thanks for coming.